Eu acho que se gasta em tudo, né? Está sendo gasto também muito dinheiro em saúde, em segurança. Mas a gente vai receber a Copa do Mundo. Sem estádio, não faz Copa do Mundo, amigo.
The Brazilian public health system, known as the SUS, Sistema Único de Saúde, is something most Brazilians are familiar with. But unfortunately, for many it's a frustrating, sometimes even terrifying experience. Today, let's explore why the system has a bad reputation, looking at issues like long wait times, lack of resources, poor infrastructure, and the direct impact on those who rely on it most. If you've ever wondered what healthcare is like for the average Brazilian, this video will help you understand the struggles they face in the public health system. The reality of long wait times. One of the biggest reasons the SUS is so frustrating for many Brazilians is the waiting time. Stories of people waiting months or even years for appointments with specialists, critical exams, or surgical procedures are common. Imagine having to wait months for a test that could diagnose a serious illness. The delays not only worsen patients' health, but, in some cases, can even lead to loss of life. These endless waits are due to the overload on the system, which struggles to meet the high demand quickly and effectively. Lack of basic resources and supplies. Another factor that makes this experience difficult is the lack of basic resources. Imagine arriving at a hospital only to learn they don't have essential medication like painkillers or antibiotics. This is a regular issue in SUS facilities, where there's often a chronic shortage of medication, equipment, and even basic hygiene materials. Many hospitals don't have enough beds, forcing patients to wait on stretchers or temporary setups in crowded hallways. These situations are dehumanizing and make this experience even more unpleasant. Poor infrastructure and hospital conditions. The infrastructure of the SUS is another serious issue affecting its reputation. Many hospitals and health centers are operating under poor conditions, with aging facilities and outdated equipment. Waiting rooms are often overcrowded, and patients are frequently packed into uncomfortable, inadequate spaces. In some places, the environment is so poor it actually becomes a health risk, as patients are exposed to potential infections due to the lack of sanitary conditions. This outdated infrastructure reinforces the impression that SUS facilities aren't a safe place to seek medical care. Shortage of healthcare professionals and overworked staff. Alongside the lack of resources, the SUS is also plagued by a shortage of qualified healthcare professionals. Many doctors, nurses, and technicians are overworked, handling enormous numbers of patients daily. This leads to increased medical errors and makes it difficult for staff to provide thorough, attentive care. Healthcare workers who should have the time to properly investigate each case often find themselves forced to give rushed, sometimes superficial care. This strain on healthcare professionals impacts the quality of service and adds to the feeling of neglect for patients. Bureaucracy and corruption. Another aspect that tarnishes the SUS's image is excessive bureaucracy and recurring corruption scandals. Many of the funds that could be used to improve patient care are either misappropriated or used inefficiently. Additionally, bureaucracy slows everything down, getting approvals, accessing exams, referring patients to specialists. Everything is a slow process. This bureaucratic red tape frustrates citizens and makes the system feel even more ineffective. Political misrepresentation. Interestingly, some Brazilian politicians still use the SUS as proof of their effective governance, claiming it as a success story for public health in the country. However, this narrative is often far from the truth. While they showcase the SUS as a symbol of accessible healthcare, many Brazilians experience the reality of corruption, humiliation, and neglect within the system. Instead of being a testament to successful management, the SUS has been a reflection of years of misallocation of resources and insufficient support for public health. Comparative models. It's important to note that there are other countries with similar healthcare systems that function much more effectively. For example, nations like the United Kingdom and Canada have established universal healthcare systems that prioritize quality, accountability, and transparency. These countries invest adequately in their healthcare infrastructure and ensure that corruption is kept in check, providing citizens with timely access to necessary services. This stark contrast highlights that while universal healthcare can work, it requires dedicated governance and consistent investment to truly benefit the population. These are just some of the reasons many people see the SIS as a broken system. Lack of infrastructure, long wait times, scarcity of resources, and bureaucratic obstacles all contribute to millions of Brazilians' negative experience. It's essential to remember that SIS is one of the largest public health systems globally, facing immense challenges to serve such a vast population. If you think healthcare should be accessible and effective, share this video to raise awareness, because only by coming together can people advocate for change and improvement in Brazil's public health system.